today.
If you have ever been in the hospital for any reason, hopefully you had excellent nursing care while you were there. This is Jennifer Hitt. She is here with the Tennessee Center for Nursing Advancement, and kind of her job for the morning, at least, if not all the time, is to really celebrate that nursing care that we rely on, right?
Absolutely. Thank you for having me.
I love that your topic really is what you're doing now with this Nurse of the Month we'll talk about, but that you love highlighting those bedside nurses, the ones that kind of, I think, what it probably encourages people to get into the nursing field to begin with.
Absolutely. We really believe in meaningful recognition for nurses, especially the nurses that are doing the heavy lifting and are at the bedside.
Yeah.
There's a lot of different things you can do in nursing, but the ones that stay at the bedside really have my heart because they work so hard and make such an impact every day.
I think it would be very difficult to define what a nurse does at that bedside. I've had experience in my life to witness it with one of my children, especially in the hospital for 8 days, which is a long time. And you watch those rotations occur, and it's nerve-wracking because you bond with the nurse on staff.
Absolutely.
And that shift, and then a new one comes on, and you think it can't possibly be any better, and then the new one comes on, and they're reassuring too.
I'm glad you had a good experience with the nurses. So there's some great nurses across the state. There's great nurses in Chattanooga, and we just want to honor those that are doing the hard work.
Well, and I love that, because how can they continue to give their all to us if we're not pouring back into them? And so that's what this Nurse of the Month is kind of intended to do.
Sure. I mean, anyone in the public can nominate somebody. You actually go to the news station's website and fill out a nomination. If you don't have all of the information on that nurse, you may just have a first name. We can try to track that nurse down for you. We understand that sometimes people are in the hospital and their focus is on getting well, not on, following up with the nurse. So we are more than happy to try to track that person down for you. So we really encourage people in the public, if there's somebody that really made a difference, please let us know. We would love to honor them.
So December was the initial one here in Chattanooga.
Yes.
It's someone named Amber Kerr. She's up on our website. But it was sweet. We were learning her mom was the one who nominated her.
That's so sweet. That's really sweet. We've seen nominations from all over, from the bosses, employers, coworkers, to just random people in the public that have met a nurse and were impacted by them along the way.
You are a nurse.
I am a nurse, yes.
So do you find that there's any one thing that kind of draws people to the field?
Well, I think nurses go into the field because they want to help people, genuinely help people.
Yeah.
And that's why I went into nursing. And so we see a lot of heart in nursing, and we see a lot of compassion in nursing, especially those that are working with patients day in, day out.
Yeah, and I don't know much about the Center for Nursing Advancement, but I would imagine the name kind of says it all. You're sort of the resource there to help with retention and be the one for them to turn to,
sure.
I guess.
So we are the dedicated workforce development office for the state of Tennessee with nursing. So we work on getting more nurses at the bedside, keeping the ones that we have healthy so that they can practice to the full extent of their ability, and working on things like program development and continuing education for nurses. So we do a lot of things, but this Nurse of the Month has by far been my favorite thing this year that we have done.
So teach us a little bit while I've got you here. We'll talk about how you can go on again and nominate somebody, because this will continue on throughout 2026. But in the day-to-day, when we're the patient at the hospital or in the office, how do you get the best experience for yourself and that nurse? Because the nurse is there to really listen and advocate and sometimes interpret for you, right?
Absolutely, yes. I mean, we understand, I think, as nurses, that when we meet people, they're not at their best. We meet people oftentimes on their worst days, and that's part of the job. And so understanding that nurses really are there to care for you, and might not seem at the moment that that's your best day, and but really nurses are really there to help you. And, I'm a big advocate for staff nurses and nurses that remain at the bedside because they do such an awesome job every day. So any way that we can recognize them.
And you think about how much our healthcare has changed over the years. I'll kind of harken back to this experience I had, and it's been 10 or more years ago now, I guess 14 years ago now, that this occurred. But I was very aware from just a day or two in that there was one of them to help me, and they had 3 or 4 other rooms that they were helping. So to realize that each person that they're knocking on the door and walking in, they're having to give their all with the time that they have.
Absolutely, yeah. And COVID really showed us I think, show the public how difficult nursing is and
Yeah.
what nurses put into the job. It also showed us how mentally straining, nursing can be. And there's a lot of nurses that, left the bedside after COVID because it was just so taxing for them. So
Right.
anything that we can do to honor those nurses that are staying at the bedside and putting in the hard work, we'd love to do that.
I also will brag on you a little bit more too, because I had a neighbor who went to nursing school here, and I didn't see Melissa, I think, for like 2 years.
That sounds right. That sounds absolutely
'Cause
correct, yes.
It is I mean, you want to talk about having to be dedicated to the study. It truly is.
It is. It's not an easy path, but we're here if anyone is interested in going into nursing, they can visit our website. We've got a lot of information on the local schools. There's a lot of great schools here in Tennessee that are doing great things. So
Yeah.
the opportunity's there if anyone is interested.
I did not ask you, and I probably should have, but when you get the nomination and you are the Nurse of the Month, is there anything that comes with it?
So we do have a plaque and a goodie bag for you, and you get a news story. So that, I believe, is already aired with the December Nurse of the Month.
Right.
And we're also going to have some things later on in the year for them.
Okay, so you go to our website. It's a partnership that we have with them. So right here on local3news.com, it is the Tennessee Center for Nursing Advancement. You nominate someone who has really been impactful in your life. Just please do make sure it's those bedside nurses, not so much the managerial side of things. That's great, but we want that heart and soul
Absolutely.
of nursing
Absolutely.
highlighted.
Thank you so much.
Great to see you.
For decades, Weathermark